Many times you have asked me about health insurance policies, how to buy a good and perfect health insurance policies. Before getting to the topic, just let me clarify I am neither an agent of a health insurance company or not connected with any hospitals and all these things. So I'm not suggesting any particular companies, but I'll reveal you what are the reality of health insurance industries. I'm a mechanical engineer by profession, working in manufacturing industry more than 2 decades. Presently, I'm holding four companies' health insurance policies by name United India Insurance, ICICI Lombard, Star Health, National Insurance, even ICICI Prudential. Earlier, also I had policies with HDFC Argo, Religare. So I am very much experienced with the reality of different insurance companies, health insurance companies, and also what as a customer need to know so that during the claim process you will not get any surprise of rejections. I'll share today. I will not suggest you for which companies you buy the policies, but I will explain you with my experience with the Star Health companies. Though it is a big company, but my experience with Star Health was not good at all. And even like present also, I have about 6 Star Health policies in last 2 years with my close relatives, including myself. And already I have ported 4 policy to other companies, and I am also planning to port rest 2 policy from Star Health to other companies because I am very much dissatisfied with the claim process, claim rejections, etc. with the Star Health company. I'll 10 points why not to buy a health insurance policy from a particular company. Say here example is Star Health. Number one is claim rejection or cashless rejection. When a person got hospitalized, then the health insurance company give an approval of cashless treatment so that you don't need to pay the majority cost of the treatment. This is called cashless. You don't need to pay anything or very negligible amount to the hospital. Rest the company will take care. Now when the person got admitted in the hospital, what happens, they give approval for cashless within 20 minutes, 30 minutes as they promised in the sales brochure or their website. The music will start after few days. After few days, I'm talking about all retail policy, not the corporate policy, because corporate policy insurance company has to pay because they are getting 200, 400, 500 policies together. So that is treating differently. I'm talking about retail policy. That means when an individual is buying any policy, it has faced a lot of problem during the claim process because company don't give weightage to the individual during the claims. So this cashless rejection, they will give a letter after 3-4 days that due to disease reason your cashless is denied, but you may go for reimbursement. So this is one of the things. It is in 50% cases in my experience with Star Health, they deny the cashless in the hospital, and this patient party got very very crisis in financial situation at the time. Then when the cashless got rejected, then you have to go for reimbursement. So you take the all original bills etc and submit it to the insurance companies. In my experience with Star Health, they don't complete their reimbursement policy even process for paying the customer or rejecting the even reimbursement more than 6 months, 8 months, even a year, you will not get the money. I don't know whether it is a strategy of the companies or not, how to make the delay of payment. Because in reimbursement, payment is in lakhs of rupees. And if the company can make delay for 1 year or 6 months, company is earning a lot of money. It may be, I'm not sure, it may be a strategy of the company to make the process delay, which I had with Star Health. Now, one of the things is very important when you are doing processing of the your claims. So you have to go to the offices, local office or the regional office or the head offices. I visited Star Health Pune office. I visited Star Health head office in Chennai. I visited local office and the regional office in Kolkata, Salt Lake. In all the areas, I had a very bad experience with the people. Not personally, with their working efficiency for a customer for processing the claim. They are very, very inefficient. They, for any checking or something, it takes months of time for Star Health. Sometimes they say we have a lot of application has come, so it takes time, and people are very much inefficient and non-cooperative in both Star Health's local offices, regional offices, and head offices. One more thing, you know, PED inclusion in any health insurance policy, pre-existing disease. Say you are declared that you have blood sugar or blood pressure, something. Now, what happens actually? If you do not include, then you will surely in any during claim it will be rejected, 200% guarantee. But if you include during taking the policy, even what will happen for any disease, they will connected indirectly or directly with the PD. Say you have sugar and you have got a lot of other diseases, they connect each and every main treatment cost and all these things, that it is directly or indirectly connected with the sugar. So with that clause or clause number these, or in exclusion of these, you will not get, company is not liable to pay any amount to you. So whether you add PD or you hide the PD, you will face the negative consequences from the companies like Star Health. Because I had, I put claim for many other companies, ICICI, Lombard, National Insurance, other companies. There was no problem at all for the claim. Even I got more than 95% payment from those. But I had a negative experience with the Star Health company. I don't know. Star Health is a big company, but I don't know whether it is a company strategy or the people are inefficient. But at the end of the day, as a customer, I'm not getting my money in claims. And one more thing, like your first introduction with the company's health insurance policy during hospitalization in the help desk in the hospital. Few months back, I had a hospitalization with one of my close relative in Kolkata. Name of the hospital is Medica Super Specialty Hospital. They are the help desk people of insurance. Star Health Insurance was very, very non-cooperative. Even the patient is so serious, and we are going asking them for a signature or something which they are bound to do. They are paying for this, and they are waiting the patient party for hours after hours. There are a lot of non-cooperation from the help desk in hospital for Star Health. And as I already said, there is a delay in claim processing. Every claim, it takes even now you will find in internet, it is not what I'm sharing. In COVID-19 cases, there are thousands of cases pending with Star Health for COVID-19, which is more than 1 year of aging. They are not settling with the customer. And customer care service is also very, very poor. Like this, these free toll numbers and all these things, they hardly will find any response from them. Actually, they may take your any what I say, this some service request kind of things. They, if you complain, they put those, and it will actually useless. It will not give any result to you actually. Even this claim settlement amount for the Star Health is also very, very disappointing. Many times say your total cost of hospitalization comes 5 lakhs, and somehow when you submit all the documents, they will connect your treatment cost with PED and all these things, and finally maybe you get 50,000 rupees or something. Okay, and problem starts with claim rejection of any companies from the proposal form. And proposal form is guided to you by the online people, whether you are purchased from online or Policy Bazaar or Star Health online or the offline Star Health agent. I have policies with Star Health, agent, as well as from online, as well as from Policy Bazaar. But all the cases, the Star Health proposal form is such that it is not exhaustive. They will ask only few questions. You have to say yes or no. And when the claim settlement comes, they will find a lot of points from there that you have not declared this, you have not declared those. Even the agent, they are either least knowledgeable, or they somehow manage to sell their product. They are least bothered about what the customer will be facing during this claim process. So these agents, sales agent, they are also very, very, what I say, they are not customer friendly actually. Somehow they manage to sell their uh, things actually. If you go, Star Health as a company is a big company. There are many, but you don't need to be impressed with such, they have got the highest network hospital and all these things. But reality is different. Even you will go to the IRDI site, you will find that they have good claim settlement ratio and all these things. But IRDA data is useless for me, because say I have submitted 4 claims to any company. I'm talking about Star Health company, which actually I submitted last year, and my 3 claim got rejected. So my claim settlement ratio is for Star Health is only 25%, not what they claim that is 90% and all these things. And whatever I have told you, these are happens with the retail customer, not with the corporate customer. So if you are a individual planning to buy any health insurance company, you must think 10 times before buying any policy from Star Health company. Hope this information are useful for you. Thank you very much for your attention and time.